Hey YouTube friends, do you have wrist pain? Are you suffering from pain whenever you go to grip something or push something or even pull something? Is it starting to ache and throb at night? And are you confused about what to do about this or why this even started because you never got hurt really, like where you fell or stretched your wrist somehow? Well, through this video today, I'm going to give you the top 3 reasons for wrist pain. Real quick, my name is Dr. David Midoff. I'm a specialist physical therapist over at El Paso Manual Physical Therapy. And I've seen people with wrist pain off and on over the years. It's not the most common thing that we treat, but it's actually quite easy to fix. We can spot the problem a mile away most of the time. And the reality is that most people in the medical industry just don't know what to do about this type of wrist pain that comes on without any sort of big break, like a fracture or big accident, like where you fall on your hand and break your wrist. Then it's obvious what the reason for you hurting your wrist was. But if you didn't have an injury like that and you're getting wrist pain, especially if it's been there for weeks or months and it's become chronic, that's confusing for most people in the medical profession to treat. So that's what I'll be talking to you about today. The first reason is a stuck wrist joint. Now, in the wrist, there's, of course, from your forearm, there's 2 bones in your forearm. One is called the ulna and the other is called the radius. Those are the ones that start at your elbow and then they go down towards your wrist. And the radius is the one that's wider at the wrist. It connects to 3, some people would argue 4 bones directly. So it has connections to 4 little bones that are called the carpal bones. And they're called carpals because they're shaped like little pebbles or rocks. And they all kind of move on each other freely. And there's another row of carpals right after that. So you actually have 8 carpal bones before you get into the actual long bones of the hand, the ones that look more like fingers. Those are called the metacarpals, and then you have the phalanges, which make up the actual fingers themselves. But all those little bones within the wrist can get stuck on each other, and oftentimes that's one of the main reasons why people have wrist pain, especially the type of wrist pain where you're fine when you're not moving, but then you go to grab something or you twist your arm or move your wrist in a certain way and it just bites you real hard and you have to kind of stop or grit through it. That almost always is a stuck wrist joint. And that can be fixed. That's something that at El Paso Manual Physical Therapy here with our manual therapy treatments, we can actually go in and find the bone, the joints that are stuck and free them up, and then teach people how to keep them free for the long term. And it's almost magical whenever we get a patient that comes in here and they have been suffering with a wrist problem, they've been wearing a brace, they've been doing all kinds of things, and then we go in and we we're able to find the joint and poke it where it hurts, and they're like, oh, yep, that's it, that's the one that hurts. We'll move their wrist in a way that we know the way the bones move, so we'll move the wrist in a way that sets it off, and they're like, yep, that's it, that's where it hurts. And then we fix the joint, we get it moving better, and then they can move their wrist normally again. Now, it's not quick as far as, it's just one treatment and it's over. We can free up the joint in one treatment. Usually there's a few more that need to happen in order to keep the joint free for the long term. But there's also exercises to do to make sure that those joints aren't getting stuck over and over again, because that will happen if we just simply free up the joint and not do exercises to make sure that the space around the joints is normalized, the forces on the joints are normalized. Then that problem will likely come back again, and that individual can keep getting stuck wrist joints. The second most common reason for wrist pain is weak grip muscles. Now, all the muscles in your forearm, almost all of them, are dedicated to moving the wrist and hand. Now, the ones on the front side of your forearm, the part that's on the same side as your palm, are focused on closing your fingers to form a grip. And the ones on the opposite side, on the side of the outer elbow where the point of your elbow is, those are the muscles that are focused on opening your hands. Now, the muscles that close your hand are much stronger than the ones that open your hand. I think of it this way. I'm still a nerd, but I was always a nerd even as a kid, and I used to watch the Discovery Channel, and I loved watching Steve Irwin, the crocodile guy, and rest in peace, he's a great guy. His kids are actually coming onto TV doing great as well. But I'll never forget watching Steve Irwin wrestle a crocodile, sit on top of it, on its neck, and hold the jaws of the crocodile shut with his bare hands. And then he explained how the muscles of the crocodile's mouth are very, very powerful and strong closing, because they have to be able to crush things and bite things and hold on to their whatever they're going to eat without it letting go. But the muscles to open the mouth are not very strong, and he can actually hold them shut and overpower them with his bare hands. I thought that was so cool. But it's the same thing with your hand. If to open your hands, the muscles that open your fingers are very weak. That's normal. That's the way they're supposed to be. You actually don't have to train them very much. But the ones that close your hands are supposed to be much more powerful, and oftentimes that's a big issue. We see people that have very weak grip strength, and that causes them to have some sort of wrist problem. It might affect the joints, like I just described, as one of the number one reasons to get wrist pain. But if that grip is very weak, it can definitely change the way that other things are moving within the wrist, not just the muscles, but there's tons of tendons in there. There's some cartilage in the wrist as well that is important to be in a certain position and to move right. And the muscle strength of the grip can be a big factor. And it's not as straightforward as just going to go get a grip ball. I mean, you have to have some serious grip strength. Some people need to have grip strength over 100 pounds, 100 pounds of force. If you think about it, that means that person should be able to pick up a weight that weighs 100 pounds and hold on to it, not overhead or even straight up in front of them, but at least dangle it within their grip and be able to sustain it. That would be 100 pounds of grip strength. So you can go backwards or forwards from there. Some people need to have 120, some people need to have 70 or 80. Generally, as you age, it's acceptable to have weaker grip strength, but I'm always from the angle of, if you're in here in my office and you're having a wrist problem and you're 80 years old and your grip strength is normal according to your age group, well, we got to get it higher to make sure that wrist pain does not ever come back. I want you to have the grip strength of a 50 or 40 or 30-year-old so that you're not dealing with any wrist problems as you go into your 90s. So grip strength is a big, big deal, and there's different ways to strengthen it. The easiest way that you can do this at home is to go get yourself a grip strengthener, the ones that have the spring on them. I especially love the adjustable ones. They have a knob with the spring on there, and you can work your grip strength with that. The third most common reason for a wrist problem, this may not make sense to everybody, but neck and shoulder problems. The reason for this is if somebody has a neck or shoulder problem, of course all the nerves that come off the spinal cord exit the neck right in the neck area, and then they go into the shoulder. They go under the collarbone into the shoulder, and some of those nerves go all the way down into the arm, past the elbow, into the wrist, all the way to the fingertips. And it is very possible, it happens way more frequently than people think, where their wrist problem is actually coming from their neck or their shoulder. And I've had it probably about close to half of the patients that come in here, we're spending quite a bit of time for their wrist problem. We're spending quite a bit of time working on their neck and shoulder, and that is the bigger factor in clearing the wrist problem up. So it's surprising with patients. I have to kind of sell them a bit on the idea of it, because they're like, well, do something to my wrist, fix my wrist, because that's where it hurts. And I have to tell them, I know we'll do something for your wrist, but we need to really focus on the neck. Otherwise, the wrist won't get all the way better. You're only looking at a 50% or less improvement if the majority of the problem is up in the neck and shoulder region. So consider, if you've got a wrist problem right now, is your neck also stiff? Is your shoulder stiff? Can you pick up both arms up all the way evenly? Do you have a history of shoulder and neck problems on the same side as your wrist problem? What side do you sleep on? Are your shoulders even? Because some people are lopsided. They can't turn their head all the way to one side versus the other. These are all signs that you've probably got a neck and shoulder problem, and that could be contributing to that chronic wrist problem that you're dealing with and are looking for help with. Well, friends, I hope that this video was helpful for you. If you know of anybody that's suffering from a wrist problem, please share this with them. Also, if you thought this video was helpful for you, please give it a like right here and hit the subscribe button right over there so that you can get notified whenever we release some new videos with helpful health tips to make your life more active, mobile, and healthy so that you can avoid surgery, injections, and medications. Thanks so much for watching, YouTube friends. Bye-bye.